Welcome to Brain Wellness, the podcast. I'm your host, Mandy NP. Each episode will bring you a new topic or interview related to brain health and wellness as part of my mission to help you on the path to a healthier, happier brain. So, let's get started. Hello, everyone, and welcome back to another episode of Brain Wellness, the podcast. My guest today is Dr. Kevin Smith. Dr. Kevin is an ear, nose, and throat doctor based in Houston, Texas, whose pioneering work is transforming the lives of migraine sufferers and optimizing sports performance through innovative breathing techniques worldwide. With a mission to help individuals to enhance athletic performance and reclaim their lives from the grips of debilitating migraines, Dr. Kevin specializes in a revolutionary nasal procedure that offers a new lease on life. As a former college athlete turned physician, Dr. Kevin's journey towards becoming a leading authority in his field was driven by a passion to make a tangible difference in the lives of athletes. His pioneering approach targets the vital role of nasal breathing in sports performance, ensuring athletes have the athletic edge by maintaining unobstructed nasal passages. His expertise extends beyond conventional medicine, encompassing a range of specialties, including facial cosmetic surgery, where his focus lies in delivering natural-looking results that enhance rather than alter. Dr. Kevin's practice is a revolutionary understanding of the connection between nasal health and athletic performance. By performing or optimizing nasal function, Kevin has helped countless athletes achieve peak performance. Excuse me, my mouth does not want to work well today. Peak performance levels and overcome performance barriers. At the heart of Dr. Smith's practice is a groundbreaking procedure targeting the root cause of migraines, a deviated septum. Through meticulous evaluation and treatment, Kevin has achieved an impressive success rate with over 4,000 procedures performed and a remarkable 90% of patients experiencing significant relief. His approach goes beyond symptom management. He's dedicated to unraveling the intricate connections between migraines and underlying nasal abnormalities. His research and case reports have shed light on the profound impact of nasal surgery, not only on migraines, but also on incredible and potential connections to other neurological conditions like Parkinson's and Asperger syndrome. Beyond his clinical practice, Dr. Kevin envisions a future where his innovative clinics serve as beacons of hope for migraine sufferers worldwide. His commitment to excellence, coupled with a deep understanding of the profound toll migraines take on individuals' lives, drives him to continue pushing the boundaries of medical possibility. Quite an impressive bio. Welcome, Dr. Kevin, to the show.
Thank you very much. You get a sticker for reading that the way you
do. Sometimes I struggle on the words a little bit, so thanks for bearing with me on that one. When the show comes live here, we're going to be in the middle of Migraine Awareness Month in June here. But as we were talking before we got started on the show, I think we're going to talk about way more than just migraines today. And I'm super excited. Having been in healthcare for 25 years, all of it to neuroscience to some aspect, the nose part of it is not one thing that I thought about a lot. So I first had to think, why would I want an ENT doctor on my show? But this is going to be a really exciting conversation today.
Oh, it will be guaranteed. Yeah. If we don't get through all of it now, we come back and we finish it later.
Sounds like a plan. Sounds like a plan. So I always like to know people's backgrounds a little bit first. So tell me a little bit about your story. How did you come to be the Dr. Kevin you are today?
Okay, well, I grew up in Dallas, Texas, played sports, played football, got a football scholarship to the University of Michigan, Go Blue, national champs 2023. I went to the game. It was fantastic. So after that, though, and I always thought even going to Michigan, which one reason I chose Michigan was because I knew I wanted to be a doctor. And they have some smart guys there at Michigan, and so I really like the fact that they stress going to class and having leaders, making leaders of all of the men that came through there. So once I finished, I went to the University of Texas Medical School in Houston, which is located in the largest medical center in the world, the Texas Medical Center. It's just phenomenal. So attended medical school there, applied for ENT there, did my residency in ENT there, and then left for a year and did a facial plastic surgery fellowship because I have a little artistic side as well. And I think that artistic side, because it demands the intricacies and the detail and the nuances and the artistry, it makes me a better ear, nose, and throat doctor too, which then led me to where I am today, discovering this root cause and the cure for migraine headaches of all type. Why? Because I actually had to practice medicine over these years, do a procedure, observe the results, do the procedure, observe the results. And just like everyone who comes through medical school, I was taught migraines were in the brain. So as I'm seeing these patients who all had history of migraines, I had to rethink things and say, okay, these must be migraine imposters. In fact, I wrote a book called The Migraine Imposter. And because I said it can't be migraine if I'm doing nasal procedures and eliminating them. But then I went on a show with a lady who'd had migraines for 41 years. She was 5 years migraine free, just devastated, disabled, couldn't do very much. And I just mentioned that everyone listening to the show could have access to me and my expertise by sending me a disc of their sinus CT scan. And so I started getting all these scans from all over the country, and every one of them had the abnormalities that I knew caused these migraine imposters.
Mm.
And that's the day about 12 years ago, when I said, oh my goodness, this is the root cause of migraine. Because this is a random trial of people sending me their scans. They've all been the top neurologists across the country. They have what migraines are supposed to be. They fit the criteria. And by the way, I don't diagnose migraine. All the patients that come see me, they come after they've been to neurologists and done all the things that they've tried to do with that. And another interesting point about that is that when you look at migraine patients, when you get a brain scan on a migraine patient, only 5% of those scans are going to show a tumor, an aneurysm, meningitis, an abscess, or something like that. So you have 95% of those people who have a normal brain scan. That tells me it's not in the brain. Especially when you look at the sinus CTs that I get, nearly 100% of them have the abnormalities that I know cause these severe headaches and migraine. And that's when I put two and two together. And so it's just been a fascinating journey. I'm so happy I went into ENT. I'm so happy I'm very observant and curious. I'm so happy it's been put in my hands that I know that, I used to say, send me a scan to see if you are a candidate. Well, when you tell me you have migraines, just send me a scan so that I know what I need to do to get you well, because I customize it based on the findings. You mentioned the deviated septum earlier. That kind of simplifies it. It's much more than that. It could be a deviated septum. It could be large turbinates. It could be some sinus disease combined with that. It could be all three. And so it just depends on what the CAT scan shows. And that's the fun part too. Because sometimes I don't see a deviated septum. I'm like, oh, okay. Now I really need to look at this. What's going on? But the deviated septum by far is the most common abnormality, because look at our nose protrudes from the face. It's subjected to injury as far back as when we're coming through the birth canal. You're not going to remember that.
Mhm.
But then as we grow, we get it dinged here and there playing sports that we brought up, contact sports, soccer, uh, football, basketball, all those things can certainly lend itself to causing an injury to the nose. You don't have to break the nose, but just a tap on the front part of that nose can cause a deviated septum and convert into a severe deviated septum, or a bone spur, if you will.
Hmm.
How's
Hmm.
that?
So fascinating.
Well, let me tell you, and let me just end with this too, because this is fascinating. The easiest way to explain this to people, especially with COVID, is if you've ever had the original COVID swab test that they put deep inside your nose, it hurt and it stopped hurting when they removed it. So what I'm doing is a procedure that removes people's permanent COVID swabs and gives them relief of the pain. Okay, does that make sense?
That's a really
That's
good
the easiest
description.
way. That's the easiest way I can put it. And people all can relate to the COVID test. And it does. It hurts severely. I went and took a COVID test the other day, and the nurse knows I'm an ENT. So she goes, "You want to do it yourself?" I said, "Sure." So I'm easing and putting it in there, just taking my time. And as I'm taking my time, that thing was still hurting.
Mhm.
And it just reconfirmed to me, which I know, headaches can be caused by problems in the nose. That thing was killing me. So
Mhm.
yeah,
Mhm.
that's the easiest explanation. So I'm removing people's permanent COVID swabs and providing relief.
Yeah, that's an interesting way to look at that. Um, as we talked again before we got on the show, I have in all the years of neurology, I've had worked with some phenomenal neurologists, but I'm only as good as the neurologist that I worked with and taught me, because nurse practitioner school didn't teach me a lot about neurology. It was all on the
Yes.
job. Um,
Yes.
but I had one in particular who taught me that most sinus headaches that people just kind of refer to as their sinus headaches are actually migraines. So treating
Mhm.
a lot of we would talk to people a lot about allergies and how decreasing the inflammation with their allergies could help with their headaches. And lo and behold, that got rid of a lot of their migraines.
Mhm.
So I'd never really thought about that structural connection though. So
Yeah.
I think that's probably a game changer for so many
Well,
people.
it's coming full circle now for you. Think about it. You got that little tidbit of information there. You combine it with a tidbit of information from me, and
Mhm.
now it all makes sense. Because when you do control by whatever means, if it's diet, removing the exposure to something, stop smoking around you or something, or you use anti-inflammatory or antihistamines or steroid nasal sprays or antihistamine sprays to control the inflammation in your nose, that can play a role in helping to reduce the swelling in the nose because you have these tissues called turbinates. They're the air filters, and they're very dynamic. They swell and shrink in response to cold, flu, allergy, eating Chinese food. When you go to sleep at night and you lie flat, one critical question I can ask somebody is, do your headaches wake you up in the middle of the night? Why do I ask that? Because I know when you're sleeping supine, the turbinates swell even more. So whatever abnormality you have is now making even more contact, is now having more pressure, and they usually wake up between 2 and 3 in the morning. And I'm like, yep, I know what you have. It's just things that you gain with experience.
Yeah.
Yep.
Yeah. Very cool. Very cool. So one thing I didn't mention before we started the show, I actually wrote a book before on migraine treatment, how to get rid of the migraines based on all the experience that I had. And I now kind of feel like I need to go add something else to that book.
You
Um,
can, yeah, you certainly can. I used to put an addendum in my migraine imposter book. I hadn't sold it for years because I'm like, that's old information. And I just wrote a 2024 addendum in the front saying I know so much more now than I knew then. And now we're going
yeah.
to start selling it again. So look for it. It'll be on Amazon, or you can call the office and get it and order it that way. Yeah.
Nice, nice. That's awesome. So we talked about those structural things that cause the migraines. In your bio, we talked about too how it can affect other neurological conditions like Parkinson's and Asperger's. What's
Ooh.
the connection there?
Okay, my dear, here we go. You ready?
Yeah.
Okay. So I have some patients who have hemiplegic migraines. They resemble a stroke.
Mhm.
Some of the symptoms that some of these patients have include tremor, stuttering when they have their migraines, tingling in the arms and legs, paralysis, temporary paralysis of the arms and legs where they can't walk, slurred speech, word garble, forgetfulness. Uh, they might go blind in an eye temporarily. Now, the first time, mind you, when I heard this, when I didn't know these were migraines, I remember her distinctly, this lady saying, when I get my migraines, my left arm goes numb and paralyzed, my left leg. And I kind of went, well, I don't know about all that. I'll get rid of the headache. That you'll have to see a neurologist for. Lo and behold, I did it, and all the stuff went away. So I have a young lady here from South Carolina whose mother called me because she was in Belgium doing some missionary work, had a hemiplegic migraine, had to be life flighted back, medevaced back to the United States, didn't know what was going on. They somehow found out about me, sent me the scan, came down, got the surgery, the headaches went away, and so did all that. She used to have blackouts to the point she couldn't remember what happened. She'd have to bring a friend to talk to the doctor because she couldn't tell him anything.
Wow.
All that went away. That's when I said, wait a minute, time out. What is this? So I just happened to say, look up, what else are migraines associated with? Migraines are associated with at least 75 neurological disorders. Let's go through a few of them. MS, epilepsy, dementia, Parkinson's, Alzheimer's, ALS, Tourette's, autism, cerebral palsy, retinitis pigmentosa, irritable bowel, Crohn's disease, chronic fatigue, just, the list goes on and on.
Mhm.
But nobody knows why or what the connection is. So what does Dr. Smith do, Mr. Curious George, Curious Kev? um, I started screening. Just for example, I'm leaving lunch the other day. I see a guy parked next to me with a tremor in his left arm. And I said, "Sir," I said, "excuse me, I happen to notice your tremor. I hope you don't mind me interrupting." He said, "No, what's going on?" He said, "I have Parkinson's." I said, "Okay, I wondered if it might have been some neurological disorder. I'm doing some research. If you wouldn't mind, take my card, come by, let's get a scan of your sinuses. I cure migraines. Sometimes they were linked to Parkinson's, blah, blah, blah." He goes, "Oh, great. I'd love to. Thanks for stopping." He just took it really well. He comes in, he gets the scan. I didn't even sit down in my chair. I just briefly looked at my CT scan screen and went, "Oh my gosh, he has the same abnormalities as my migraine patients."
Hmm.
He's going to have his procedure coming up pretty soon. And we're just going to observe what his response is.
Mhm.
Get this, Michael J. Fox. I've always speculated with that little turned up nose he has that he has something going on inside his nose. What comes to find out, his first symptom in 1996 was a headache
Mhm.
and a tremor of one of his fingers. Then just last year, I read he has had two septoplasties to correct a deviated septum in his nose. Again, the most common abnormality I find.
Mhm.
That tells me there's something still there. There's something still going on. Again, my septoplasty is not done just for breathing.
Mhm.
It's done in a high level, detailed way to make sure that you don't have headaches. I'm sure he has some residual something in his nose. I just
Mhm.
need to get his scan. And then I predict that I can at least halt the progression of his disease. I'm not saying I can cure it or he'll come back to normal because, as you know, the brain is very uh, has lots of neuroplasticity and the things that have formed with the neurons and things have already formed, and so he might have some residual of that. But with some of my patients, though, who have these things, these unusual symptoms, they go away when I perform the procedure.
Mhm.
So the connection. And when we think about it, the nose, if you have an irritated focus in the nose, it throws the body off. Let's just think about the body. It's made of nerves. If you have something abnormal in your nose throwing off your body, then it makes sense to me that you could have any symptoms, because now you're always in that constant, you know, fight or flight or irritated focus. You're never really relaxed and
Mhm.
just normal.
Mhm.
So yes, I'm looking at all that. When you
Hey,
have an unusual neurological disorder, I believe it's going to come a point where you need to send me your scan. Let's see what you have in your nose, fix it, and see what happens. I can't tell you what's going to happen because it's very preliminary. It's very new. I have had a kid with Asperger's. He had headaches too.
Mhm.
Came in, got his procedure. His mom says now he's able to work. He's a little more interactive.
Mhm.
No, he's not ideal. He's not normal, but he's better, and
Yeah.
he doesn't have headaches anymore. Um, um, Yeah. So yeah, I've screened 3 or 4 Parkinson's patients. They've had the abnormalities. A, I have a Hall of Fame NFL football player with severe dementia, has a severe deviated nasal septum.
Mhm.
I just saw an NFL player last week. He has sleep apnea. He has insomnia. He has headaches, migraines, and he's got the abnormalities in his nose. So he just needs to breathe better.
Mhm.
All of that helps to have great brain wellness you talked about.
Mhm. Yeah.
It does. The one benefit of my procedure is that, you're going to be breathing better, getting more oxygen. You're going to be sleeping better. You're going to have more energy when you wake up. And so that breathing better and sleeping better and not being sleep deprived, your brain is going to be healthier.
Yeah. Yeah.
Did I
And
answer the question?
yes, absolutely. I've also been thinking as we're talking, like just my neurological background, I'm trying to think of
Yes.
the cranial nerves. The olfactory is a cranial nerve. So if we think about just location wise in the brain, it makes sense that other neurological things can be affected because there are other cranial nerves that come out very close to cranial nerve one.
Now you're getting, and also an entity called cortical depression,
Mhm.
where I liken it to, as we have these storms coming through the United States, you can see one lightning bolt hit a tree, but you can also look in the sky and you see lightning just spread across the sky.
Mhm.
That's how I describe cortical depression to my patients and why they might have these multiple neurological symptoms along with their migraine.
Mhm.
As the firing goes back from the nose to the brain, it is go,
Mhm.
and it's hitting all these different nerves. Somebody might have abdominal cramps. I had one lady tell me, Dr. Smith, you know what's crazy? My migraines are gone, but I've been constipated since I was 19 years old, and it's gone now. So I write that down. See, I don't just let that
Vagus
go
nerve.
over my head.
Yeah.
See, I don't look at it and say, constipation. I don't care about that. I'm an ENT and let it and just push it aside.
Yeah.
I'm really like, okay, constipation. Let me just jot that down. Another young girl, 17 years old from Louisiana, migraines. Um, I can't eat pasta or pizza, Dr. Smith. My stomach is always bloated. She's thin as a rail. She said, I can't eat that. She comes back after a procedure. No more migraines. And she goes, Dr. Smith, oh, by the way, Dr. Smith, I'm eating pasta and pizza. I can't believe it. And my stomach's flat. I write that down.
Mhm.
I have to.
Uh-huh.
I'm a student of medicine is my thing. ENT is my thing. So I'm always been curious, excited. I learned the foundation in medical school, but I was also like, wait a minute. I'm beginning to see a little something here that needs to be observed and
Yeah.
tested and observed again and tested.
Mhm.
And it's just so exciting. If the connection between all those neurological disorders is in the nose or
Yeah.
contributes to it in some way,
That's really cool.
it's really cool. And you know what? I'm thinking about you and me. We're going to have to get together because you got the neurological background. I've got the ENT background. We might have to do our own book.
Well, there we
Seriously.
go. There we
Yep.
go.
Yep.
Yeah, because as you were describing that too, so all those GI symptoms, the vagus nerve goes all the way down to the balls. So there's another cranial nerve right there.
Come on now.
Mhm.
And it's all
I
right
love this
here.
connection.
And it's all right here.
That is
It's
so
starting to make
cool.
sense.
Yeah,
You're having light bulbs just go off, aren't you?
I am. It's really cool.
Okay, good. I'm excited. Because see, you're excited. See, you're
Yeah.
an expert in neurology. I'm an expert in ENT. We can bring this together and we can do some great things, my dear.
Hmm.
And you got the
Hmm.
platform. You got your platform here with your podcast. So yeah,
Yeah.
we're gonna talk.
I think we're gonna have to. There's some cool stuff in here. So the other thing I want to ask you about is something else that came up before we got on the show was
Yes.
the fact that I had my TBI last year, and we were
Yes.
going to talk about these TBI headaches. So tell me what you know about that.
Okay. I'm gonna walk you through this one. I'm a teacher by heart. I don't know if you
Yeah.
can tell. I just
Yep.
love, I like breaking things down into digestible pieces.
Yeah.
I believe in addressing things from the root cause.
Hmm.
I believe that there's a logical way the body is made. We just have to find out and look and figure it out.
Hmm.
A lot of things I don't know, a lot of things you don't know, a lot of things we don't know, but a lot of things we can figure out and make sense of. So
Yeah.
let's talk about TBI. And then we're going to talk about, remind me about this too, about TIA and mini strokes. We're going to hit
Yeah.
on that.
Yeah.
Traumatic brain injury. To get one, you have to be in a horrific accident of some sort, right? When you do that, you can have abdominal injuries, you can have long bone injuries, you can have a bleed in the brain or what have you. Those take precedence over the nose, right?
Hmm.
Nobody's thinking about the nose at that point. However, if your head got hit, it's likely your nose got hit. All right. Even if you broke your nose, it's not high priority. Set the nose, call ENT. We got to deal with the rest of this serious stuff. And I agree wholeheartedly. But what happens to every traumatic brain injury patient is once all those things have healed, you're left with this nagging headache and or migraine. And what everybody is told is you get a pat on the back. That's part of your TBI. That's your history. You got to live with that. We have some medications we can try. We got to live with that. I don't agree with that. Once you cross over and you have residual chronic headaches and migraines, that's when Dr. Smith comes into play. And what does Dr. Smith say? Okay, let's get a sinus CT scan, send it to me, let me review it. And I stress that I'm the expert in this area. You can have your ENT at home review it. You can have several ENTs review it. You're going to get several different answers from, oh no, it looks pretty normal. No, that's not the cause of your migraines. Oh, you have a huge septal spur, but no, that's not causing the TBI. TBI is just you just left with what you left with. I wouldn't. No, I don't think that's going to do that. Don't take that chance. You deserve to live the best life you can. Send it to me. Let me look at it. I'll find the abnormalities. Then come to me. Let me fix it and be done and put that behind you. But instead, we have all these people who are just left with, oh yeah, they're taught to accept that, yeah, this chronic oh, I had a bad TBI. It was a horrible accident. Da 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 da. I had this and that. I'm like, okay, but that's all healed, right? That should be done. So now we need to find the cause of this migraine and headache, and that's where I come in. And it's so gratifying too to take somebody.
Mhm.
I'll take you, and I'll take your husband and whoever else you might know with TBIs, because you have your little TBI community. We're gonna screen. No, we're gonna screen them all,
Mhm.
and those that are positive, we're gonna fix them all. Because life is short. Life is meant to be lived. You better live it to the best of your ability and not accept. You have to fight for your health,
Mhm.
and I'll help you do that. So does
Mhm.
that make sense?
It does. It does. Um,
Yay.
so it all started with floor hockey back in elementary
Mhm.
school, right? Getting the
Yep.
floor hockey puck to the nose. I'm sure I
There
got
you go.
something abnormal up there.
Of course you do. Of course you do.
Funny, funny.
Yeah.
All
Oh,
right.
oh,
So
mini strokes. You
yes.
can go to
Yep.
that now.
Yeah.
Okay. We're on a roll. Um, there are some young folks and even older folks. When you go into the hospital and you're thought to have a stroke, you get the stroke workup, right? And you have to.
Mhm.
And most often you're going to have either a bleed or a clot. Is there anything else?
There's the mini strokes. Yeah. The
Then there's,
TIAs. Yeah.
but who gets that label? Let me get that from you. Let's talk. Come on,
So
man.
yeah. So when I
Who
first
gets to
started in
be?
healthcare,
What does a scan look like in a mini stroke or a TIA patient?
it's negative. You don't see anything.
Ooh, can you say that a little louder, please?
Yeah. There's
Brain
nothing on
scan
the
is
imaging.
negative.
Hmm.
So, so my question is, how then do you know if the mini stroke and the TIA is not a hemiplegic migraine that we just talked about earlier?
Some of them very well could be. It's a lot of it comes down to history if they had a headache with it or not.
That's true.
Mhm.
That's true. But you can have silent migraines as well.
This sounds true. Yes.
Oh, so my thing with that is, again, there's a big difference between you getting health insurance and saying I had a mini stroke at 40
Mhm.
or a TIA at 35 and carrying that for the rest of your life, or saying I had a hemiplegic migraine that Dr. Smith fixed, but it's gone now. So that's not relevant. So all that to say is, and I talked to one of the top neurologists here at the Texas Medical Center that developed the mobile stroke unit.
Yeah.
And I just hit me. I said, Doc, he's my professor. I said, how do we know that some of these mini stroke and TIA patients aren't hemiplegic migraines? I think they should all get sinus CT scans, and you got to send it to me because, again, you'll get the, no, that can't be causing that. Oh, I see a little something here, but it's not causing that. You get all those answers. Send it to me. What does it hurt to send it to me, have the procedure, and see if that comes back or not? Even if it's, a lot of times these might be years in between episodes,
Yeah.
but those 1 or 2 episodes are pretty traumatic, and you're always living in fear. You don't know when it's coming on. I had a friend, a golfing friend of mine. He must be 40 maybe, and he had an episode come through his eye. He couldn't open his eye, one of his eyes, and he had this stuff going on. Healthy as a horse, though. Healthy as a horse.
Mhm.
And he goes, Kev. I said, well, come by. Let me just see. Let's do a scan and see what you have going on. He has the abnormalities. And then he tells me, this happened when I was 27. And so I'm thinking, that to me doesn't make sense to me.
Right.
That's a very, very, very rare occurrence for you to have had a TIA or a mini stroke at 27. It's more likely that since you're an athletic guy, these abnormalities on your CT scan cause a hemiplegic migraine then, and for whatever reason, you went years and it happened again.
Mhm.
And of course, I got the answer. Well, let me run it by my neurologist, and the neurologist like, no, I don't know if you need to have, anesthesia yet. Let's just wait and see if it goes. His eye finally came back after several months, but he's still sitting there with the ticking time bomb. He's still sitting there.
Mhm.
And so it may happen again. He's going to go to the ER. They're going to work him up again, and everybody's going to be frantic. And he might get I had one lady with hemiplegic migraines who got worked up for a stroke and got the streptokinase, right? Is that the clot buster med that
Oh,
they
yeah.
give now?
Yeah.
Yeah, she got all of that, and she was resistant. She's an engineer, Georgia Tech engineer, knows a lot. They want to know everything about it. What do you mean, Dr. Smith? Are you sure this could be it? I'm like, look, I'm the expert in this area. Let's do this and see how you do. Hadn't had a problem since. No more headaches, migraines, no brain fog, garbled speech that she had, nothing. And she's a believer now.
Mm. Mm.
So that's my
I'm
TBI.
surprised they gave a clot busting medication to somebody when they suspected it might be TIA.
Hey,
There's so many advanced images now that can tell us
yeah,
whether or not a stroke is actually
yeah,
occurring
yeah,
or not. So that
yeah,
kind of surprises me a little bit.
yeah.
Uh, I know one thing in my practice before, if somebody came in with recurrent symptoms, it was no longer a TIA because you're not going to have a
Uh-huh.
TIA in the same spot anyway.
There
So
you go.
that's when we would change the terminology to
There you
more
go.
of like a migraine. Even if they didn't have a
Gotcha.
headache, we would call it
Good.
the acephalgic
Wonderful.
migraine. Mhm.
Wonderful. I like that. Yeah. Sounds like you all were on it. Yep.
Yeah, yeah.
Yeah.
I just didn't know
Good.
about the sinus part of it. So yeah,
Hmm.
that's a cool little
Okay.
addition there.
Well, we're
Very
hitting on
cool.
some great topics here, boy.
I
This
know.
episode is
I
going to be
know.
just top notch.
So one of the other questions that I wanted to kind of cover is the future of migraine treatment, but I think we've kind of been talking about it here
That's
as we
it.
went along
This is it.
anyway.
This is the
Yeah.
future of it. I'm the only doctor that I know that does it. So for the rest of my life, I've got to train other surgeons. I've got to, you know, train them how to look at scans, train them how to do the procedure so I can help more people. In the United States, there are 40 million people in the United States. You mentioned I've only done like 5,000.
Yeah.
A lot of people left. And
It's
then
a lot.
worldwide, there are 1 billion people. So I have a lot of
Yeah.
training, teaching, lecturing to do. And I'm excited about that. I really
Hmm.
am.
Hmm. Yeah, because that was going to be my other question. Is there anybody else that does this? But I don't think so. So
Nope. Little
very
low.
cool. Very cool. Oh, you got a lot of work on your hands.
I do, but I love it. When you love what you do, it's not work.
It's very true. Very true. Where can people find you if they want to connect and get information?
Certainly, there's several ways. Our phone number is 713-795-0600. The website is kevinsmithmd.com. You get a lot of great information there. But if you really want to see some good stuff, you go to my Smith Center Otolaryngology Facebook page to see dozens and dozens and dozens of video testimonials, me talking to patients, them talking about how they were before, how they got their life back now. It's just very fascinating when you go to the Facebook page. And then on Instagram, we have a few posts there as well. It's at Smith Center. So
Okay.
those are the ways to get a hold of me. And
Awesome.
again, if you're out of town, you don't live in Houston. I just saw before the show, I just had a plastic surgeon from Mexico. Headaches, migraines. He had splints in his nose. I had to keep him for 2 weeks. So I went in, took his splints out. He looks fabulous. He already can tell
Mm.
after 2 weeks the irritated focus in his nose that caused him to have trouble working. It's hard to work. He just described it, and I knew what he was talking about. You're trying to do it would be tough for me to do surgery if I have this irritated focus while I'm
Mhm.
trying to do surgery. You're not your best.
No.
So yeah, so we get them from all over the world. Steve Harvey sent me his business partner from Dubai and then flew me out to Dubai. They're thinking about a clinic out there. It's
Yeah,
exciting. So yeah,
it
if
is.
you don't live in Houston, just get a sinus scan. Tell your doctor, wink, wink, you have headaches and facial pain. Because if you say migraine, you're going to get a brain scan.
Yep.
Yeah, I have a lot of
Yeah.
headaches and facial pain. I need a sinus CT scan.
Yeah.
Have the facility mail the disc to me. I'll look at it, give you a call, or you can email it to me. I have people from out of the country. They can somehow how they can email it to me.
Electronic.
I can look at the
Hmm.
images there, or get into their EMR, their portal,
Hmm.
and see them through that. So all those ways are possible.
Very
Don't
cool.
sit on a migraine thinking that, oh, and especially if you're like this one lady who attacked me and said, my migraines are genetic. You trying to tell me you can change my genes? Here's how I broke her down.
That's what our
Ma'am,
sinuses can be genetic too.
they can be, but even better. I hit her with this.
Yeah.
Genes can cause spina bifida,
Mhm.
but we do surgery on the spine as a result of the bad gene. We don't change the gene,
Mhm.
but we can straighten the spine with surgery. So if you have the abnormality, it's due to your genetic makeup, hereditary. I've cured families with migraines.
Mhm.
If it's related to genes, I don't really care. I'm looking for the abnormality. And if you have it as a result of your genes, I can fix that. And she was like, oh, never mind. No, I'm just
That's a great comeback, though. Very
yeah.
true. I think we could probably talk all day long, but I think for sake of time, what would you like to leave our listeners with today?
I would like to tell you that life is meant to be lived. Um, at my age, I was just thinking that if I lived to be the average age of a male in the United States, as much as I love playing golf and enjoying springs and summers and fall, I have 8 of those seasons left. That's single digits. Now, my parents didn't live to be average. My father at this age had 30 more. But that's some way to think about it. So for when you think about it like that, for the things that you enjoy, you deserve to live your very best. And so if you have chronic headaches, if you have chronic migraines, if you have neurological disorders, all the ones we talked about, and you're interested in being involved in helping yourself, I'm a doctor that can help you with all my might to get some answers. And I'm going to look high and low for you. So I love people to just understand that life is not fair. Life is real. Life is meant to be lived. And I'm doing my very best in my little area to help those with all those chronic conditions live better. And if you have a connection to Michael J. Fox, have him send me a scan, because all that money could be going to really researching the area that's going to give them the most benefit.
Hmm. Hmm. Very cool. Good words to end on. Thank you so much for being here today, Dr. Kevin.
Thank you for having me. And anytime you want to collaborate on this book or whatever you think about, just let's stay in touch.
Sounds good. Perfect. Thank you so much.
You're very welcome.
Thanks for tuning in to this episode of Brain Wellness, the podcast. If you enjoyed this episode, I encourage you to subscribe, like, and share this with others to help me continue on with my mission to help people live healthier, happier lives. Go to www.brainwellnesssolutions.com to see what I'm up to and get links to all the social medias there. See you next time.